$2,000 a month. For decades, that number felt like enough. Pay the bills, buy the groceries, keep the lights on, maybe take a trip once a year. $2,000 a month was the retirement dream for millions of American workers. Save enough, collect Social Security, live simply. It would be fine. It is not fine anymore. And the numbers that prove it are not opinions. They are not political arguments. They are not scaremongering from financial advisors trying to sell you something. They are the actual costs of actual life in America in 2026. I am going to walk you through them category by category. Housing, healthcare, food, transport, everything. And by the end of this video, you will understand exactly why $2,000 a month, the number that the average American Social Security benefit barely reaches, is no longer enough to retire on in this country. And you will understand why more Americans than ever before are doing something about it. Let me start with a number that should stop you in your tracks. The average American retiree household spends $5,000 per month. Not a wealthy retiree, not someone with a vacation home and a boat. The average retiree, $5,000 per month, $60,000 per year. That figure comes from the Bureau of Labor Statistics. It is based on actual spending data from households headed by someone 65 or older. Now here is the other number. The average monthly Social Security retirement benefit in 2026 is $2,071. $2,000 out. That gap, nearly $3,000 per month, is the retirement crisis that nobody in Washington is talking about honestly. If you are relying primarily on Social Security, you are starting every single month nearly $3,000 short of what the average retired American actually spends. Where does that money come from? Savings, pensions for the lucky few who have them, part-time work, family support, or, increasingly, it simply does not come. And people make do with less than they need. Let me show you exactly where that $5,000 goes. Housing, the number that broke the dream housing, is the largest expense in retirement. It always has been. But what has happened to housing costs in America over the past decade has fundamentally changed what retirement looks like. The average retiree household spends $1,787 per month on housing. That includes mortgage or rent, property taxes, insurance, utilities, and ongoing maintenance. $1,787 on housing alone. That is 86% of the average Social Security benefit, spent before you have bought a single item of food, paid a single medical bill, or put a single gallon of gas in your car. And that is the national average. In California, in New York, in Florida, in any major coastal city, housing costs run significantly higher. A one-bedroom apartment in Miami averages over $2,000 per month in rent. In Los Angeles, closer to $2,500. In New York City, significantly more. But even in lower-cost states, the situation is not comfortable. In Ohio, a modest one-bedroom apartment in a decent area of Columbus runs $1,000 to $1,300 per month. In Tennessee, similarly. In Texas, which many retirees have moved to specifically for affordability, rents have risen sharply over the past 5 years. A one-bedroom in Austin runs $1,400 to $1,800. And rental prices do not include the hidden costs of housing that retirees consistently underestimate. Maintenance, the water heater that breaks in January, the roof that needs repair, the air conditioning unit that gives out in July. Homeowners spend an average of 1 to 2% of their home's value on maintenance every year. On a $250,000 home, which is modest by current standards, that is $2,500 to $5,000 annually. Roughly $200 to $400 per month that does not appear in the headline rent figure but is very real. Healthcare, the expense that grows every year. Healthcare is the second largest expense in retirement, and unlike housing, which is at least somewhat controllable by choosing where to live, healthcare costs in America are almost entirely outside your control. According to Fidelity Investments, the average retiree will spend $172,500 on healthcare throughout retirement. For a married couple, that number doubles to $345,000. That is not over 1 year, That is over a retirement lifetime, but spread across 20 years of retirement, it amounts to approximately $8,600 per year per person, over $700 per month just for healthcare. And that is the average. People with chronic conditions, people who need specialist care, people who require prescription medications that are not fully covered, their costs run significantly higher. Medicare helps, but it does not make healthcare free. The standard Medicare Part B premium alone is $202.90 per month in 2026. That covers only one component of the overall cost. Add Part D for prescription drugs. Add supplemental Medigap insurance to cover what Medicare does not. Add dental, which Medicare does not cover at all. Add vision. Add hearing aids, which can cost $3,000 to $6,000 and are largely not covered. The average retiree spends $669 per month on healthcare, according to Bureau of Labor Statistics data. But that figure is an average that includes relatively healthy 65-year-olds pulling the number down. By 75, by 80, healthcare costs for most Americans are significantly higher. Here is the part that makes this genuinely frightening. Healthcare costs in America have risen faster than inflation for decades. They rose when the economy was strong. They rose when the economy was weak. They rose through recessions, through pandemics, through every political administration of the past 30 years. There is no realistic scenario in which healthcare becomes more affordable for American retirees in the next decade. The trajectory is clear, and it is upward. A retirement budget that works at 65 will not work at 75 if healthcare costs continue on their current path. Food, the cost that crept up on everyone. Food used to be the easy category. Groceries were manageable. Eating out was a treat, not a necessity. Then came the inflation of the early 2020s, and while the headlines eventually moved on, the grocery prices did not fully come back down. Americans aged 65 and older spend an average of $642 per month on food, $7,714 per year, including both groceries and dining out. $642 per month for one person eating modestly. For two people, a retired couple, that number roughly doubles to $1,200 to $1,300 per month. This is not dining at restaurants every night. This is not extravagance. This is the actual cost of feeding yourself in America in 2026. Groceries have not returned to pre-pandemic levels in any meaningful category. Eggs, meat, dairy, fresh vegetables, all significantly more expensive than they were 5 years ago. And the fixed income problem compounds this in a specific way. When you are working, a bad month, an unexpected expense, a price increase, could be absorbed by working extra hours, taking on additional projects, finding some flexibility in your income. In retirement, on a fixed income, there is no flexibility. When grocery prices rise 5%, your Social Security benefit does not automatically rise 5%. The cost of living adjustment that Social Security applies each year has consistently lagged behind the actual inflation experienced by retirees, particularly in healthcare and housing, the two categories where older Americans spend the most. Transport, the cost nobody factors in correctly. Most retirement planning articles mention transport as a secondary expense. It is not secondary. The average retiree spends $752 per month on transportation. $752 every month on getting from place to place. This includes car payments or car ownership costs, insurance, fuel, maintenance, and occasional rideshare or taxi expenses. American retirement is largely designed around car ownership. Unlike most of Europe or Asia, where public transportation makes car-free life genuinely viable, the United States, outside of a handful of dense urban centers, requires a car to function. The pharmacy is not walkable. The grocery store requires driving. Medical appointments are across town. Family visits involve highways. A car that is paid off still costs money. Insurance averages $1,200 to $2,000 annually. Maintenance and repairs average another $1,000 to $1,500. Registration and taxes add more. And as retirees age, as driving becomes more difficult, as night vision deteriorates, as reaction times slow, the option of simply not owning a car is often not available in American suburban and rural environments. The transport cost is not optional. It is built into the structure of American life in a way that cannot be easily avoided. Putting it all together, let me add this up clearly. Housing, $1,787 per month. Healthcare, $669 per month. Food, $642 per month. Transport, $750 per month. That is $3,850 per month. And that is before entertainment, before clothing, before any travel, before gifts for grandchildren, before any of the things that make retirement feel like a reward rather than a survival exercise. The full average monthly spend for an American retiree is $5,007. The average Social Security benefit is $2,071. The gap is $2,936 every single month. Nearly $3,000 every month. That has to come from somewhere. For Americans with substantial savings, with pensions, with investment portfolios, this gap is manageable. Uncomfortable, but manageable. For the tens of millions of Americans who approach retirement with modest savings and Social Security as their primary income, this gap is the difference between a retirement that works and one that does not. The math that should concern everyone. Here is a calculation that puts the problem in sharp relief. The median 401 balance for Americans aged 60 to 69 is $210,724. Using the standard 4% withdrawal rule, the guideline that financial planners use to estimate how much you can withdraw annually without running out of money, $210,000 generates approximately $8,400 per year, $700 per month. Add the average Social Security benefit of $2,700 per month. Total monthly income, $2,771. Monthly expenses, $5,000. Monthly shortfall, $2,229. At that rate, the remaining savings run out in under 8 years. If you retire at 65 and live to 85, which is not an exceptional lifespan, it is increasingly the average, you will outlive your savings by roughly 12 years. 12 years of retirement with no savings left, living entirely on Social Security. $2,071 per month in a country where the average retiree spends $5,000. This is not a fringe scenario. This is the mathematical reality facing a significant portion of the American workforce that is approaching retirement age right now.
Her türlü yemek var. Karşıda masaj salonu var görüyorsunuz.
65 is no longer the retirement age for many Americans.
Orası diyorum, evet.
It has become a goal that keeps getting pushed back. Some downsize aggressively, sell the family home, move to a small estate, cut every possible expense. Some rely on family, move in with children, accept financial support, a solution that works for some and creates its own complications for others. And a growing number, a number that has been increasing every year for the past decade, make a different choice entirely. They leave, not forever, not always, but they do the math, look at the gap, and start researching what $2,000 a month actually buys somewhere else. In Dar Lat, Vietnam, a city at 1,500 meters elevation with a permanent spring climate, $2,000 a month covers rent, food, transport, healthcare insurance, and leaves several $100s over every month. In Chiang Mai, Thailand, in Medellin, Colombia, in Porto, Portugal, in dozens of cities across the world where the infrastructure is modern, the climate is pleasant, and the cost of living is a fraction of what it is in the United States. The Americans who make this move are not giving up on America. They are not unpatriotic. They are doing exactly what Americans have always done, looking at a problem clearly and finding a practical solution. The problem is that $2,000 a month is no longer enough to retire in America. The solution for a growing number of people is somewhere else. Thanks for watching. If this video described your situation or the situation you are trying to avoid, let me know in the comments. I want to know where you are in this process. Still planning, already made the move, considering it but not sure. And if you want to see exactly what $2,000 a month buys in Vietnam, I have a full video on that already on this channel. See you in the next one. Let me talk about one more thing that the numbers do not fully capture: the psychological cost of financial stress in retirement. Retirement is supposed to be the reward. 30, 40 years of work, decades of saving and planning and deferring. The promise was always the same. Work hard now, live well later. When the math does not work, when every month ends with less than it started, when unexpected expenses become genuine crises, when the question of whether you can afford the medication is a real question, something happens beyond the financial. The stress of financial insecurity is one of the most well-documented drivers of health decline in older adults. It affects sleep, it affects cognitive function, it affects relationships, it shortens lives. A retirement that is financially comfortable is not a luxury. For most people, it is a health requirement, and here is the cruel irony of the American retirement situation in 2026. The people who are most financially stressed in retirement are often the people who worked the hardest: the factory workers, the teachers, the nurses, the small business owners who never quite built the investment portfolio that the financial planning industry told them they needed. People who did everything right by the standards of their generation, worked steadily, saved what they could, planned for a retirement that the cost of living has since moved out of reach. They are not asking for luxury, they are asking for the retirement that was promised. And the numbers say that promise has been broken. There is something else worth saying directly. The retirement crisis in America is not new. It has been building for decades. Defined benefit pensions, the kind that guaranteed a fixed monthly income for life, have largely been replaced by defined contribution plans, like 401s, that put the investment risk entirely on the individual worker. When the market performs well, 401 balances grow. When the market drops, as it did in 2008, as it has done multiple times since, balances collapse precisely when people need them most. The shift from pension to 401 was sold to American workers as a choice and an opportunity. In reality, for many, it was a transfer of risk from corporations to individuals who had neither the financial training nor the time to manage that risk effectively. The result is a generation approaching retirement age with savings that are inadequate, healthcare costs that are rising, housing costs that have outpaced inflation, and a social security system that was never designed to be the sole source of retirement income, but has become exactly that for tens of millions of Americans. $2,000 a month was never supposed to be enough on its own. The problem is that for many Americans, it is all there is. So let me end with a question that I genuinely want you to sit with. Not a rhetorical question, a real one. If the math says that $2,000 a month is not enough to retire comfortably in America, what is your plan? Work longer? That is a valid choice if your health allows it and your employer values your continued contribution. But it is not a choice everyone can make. Bodies wear out, industries change, age discrimination, despite being illegal, is real. Save more? Also valid if you have the income and the time horizon. But for people within 10 years of retirement, the compounding math is significantly less powerful than it was at 35. Cut expenses aggressively? Possible. But there are limits to how far you can cut housing, healthcare, and food, the three categories that together consume most of a retiree's budget and that are the least controllable. Or reconsider the geography, not permanently, not necessarily, but honestly. If the same budget that creates financial stress in America creates financial comfort somewhere else, if $2,000 a month buys a full, dignified, enjoyable life in another country, then the question of where to retire becomes a question worth asking seriously. Thousands of Americans are asking it right now. Their answers are landing in Vietnam, in Thailand, in Portugal, in Colombia, in Mexico. Not because they have given up on America, because they have done the math. And the math sent them somewhere else.